ligaments, you're trying to stress them in a way that lengthens them, okay? So if I'm going to test the medial collateral ligament, I'm going to push on the opposite side, okay? My subject has to be completely relaxed, so relax.
Relax, Tyler.
Okay? If he's tight in any way, I'm not going to get a good test. So a lot of times, and they don't do it on purpose, but they're trying to be helpful. Okay, usually they're like, oh, well, I'll lift my leg up for you. Well, what happens when he lifts his leg? What muscles contract? It's the quads, right? Which are knee stabilizers. So if his quads contract, now all of a sudden everything's tight here. So I try and get them to relax. So a lot of times I'll just kind of do this with their leg and see like right now he's not relaxed because his knee won't. There. If he's relaxed, it's just going to flop wherever I want it to flop. So that's kind of what I do is I'll say just let everything flop around. So I'm going to grab his knee, okay? I'm going to medially rotate him at the thigh so that this kind of the medial side's exposed more. Okay, relax. You're tightening. Okay. So I do it at a full extension, and I also do it at 30 degrees flexion. 30 degrees flexion isolates the medial collateral a little bit more because it takes everything out of play. So I'm going to push medially into what kind of stress? Valgus or varus? I'm pushing it here. Valgus. Okay. Relax. Let it hang. There you go. So I push with a push on the lateral side of the knee. I pull a little bit with my hand that's at the ankle. Okay. And when I do that, there's just a tiny bit of movement. Okay. Not a lot. If you guys were doing this, you'd be like, I don't feel anything. Most of the time you don't if their ligaments are intact. Okay. When I go to 30 degrees, it's a little bit tougher because the hip wants to rotate a little bit. Okay. But if I stabilize there, I can get a little bit more movement. So not a lot. He's got really, really tight, strong medial collateral ligaments. To do the lateral side, I would do exactly the opposite. What type of stress am I applying?
Varus.
Varus stress.
Yes.
Okay. Play dead. Play dead. Play dead. There you go. Let it relax. Let it go straight. Okay. So I'm going to rotate so that I have him rotating medially again. I'm going to apply varus stress. I'm pulling a little bit with my hand that's on his ankle, and I'm testing the lateral collaterals. Lateral collaterals, sometimes you can get a little bit more movement. Can you feel that little bit of like kind of weird pop? Like, okay? If you can get it, there it's stretched, and there it's not, and it's back in place. So what he feels is the rocking of the tibia and femur. He just feels that rock just a little bit. Okay, so that's the valgus and varus stress tests for the medial and lateral collateral ligaments. If I'm checking the ACL, and again I would do that injured, uninjured, both sides, I always show the patient, okay, this is what I'm going to do to you, so then they know and they're not freaking out. And by that point I also have them like understanding relaxed versus not relaxed. To do a ACL test, the drawer is one of the simplest and easiest to do no matter what size of the athlete, okay? When I do an anterior drawer test, a drawer is just what it sounds like. When you pull a drawer out, I'm trying to pull the drawer, okay? I medially rotate his foot a little bit. A lot of times it helps if I sit or I put a little bit of pressure on his foot to stabilize it, because otherwise when I pull, the foot might slide out, okay? I put my hands behind on the hamstring tendons to make sure they're not tight, because if he's tight there, he's going to be holding that tibia in place, okay, because they attach down here on the tibia and fibula. I put my thumbs at the joint line, okay, and then I just pull the tibia towards me, just a small movement. If there's a tear in the ACL, when I pull like this, it'll shift out towards me, okay, there'll be a big shift. So all I do is pull. If I'm testing the posterior cruciate, it's the exact same move. I just push, okay, and when I push backwards, the tibia may shift backwards if there's a PCL tear. PCL tears aren't real common, okay? The other thing that you kind of have to watch is when they're in this position, if they have a PCL tear, the tibia might actually already sit back. If that's the case, when I pull forward, it's going to look like it's an ACL tear, but it's really not, it's PCL. Again, not real common, still have never seen that. Another test for the PCL is to relax. I put him into 90 degrees hip flexion, 90 degrees knee flexion, and I just hold the foot here, okay? Try and make sure he's relaxed. Okay, just let your leg play dead, there you go. when he's in this position, if the PCL is torn, the tibia is likely to sit back, because what's the job of the PCL? Okay, it holds the tibia, it attaches to the posterior part of the tibia, the anterior part of the femur, so if that's torn, it's not gonna hold and it'll just shift back, okay? And then the last one for an ACL test is called a Lockman's. And to do a Lockman's test, it's just like a drawer, except it's in a little bit different position. I place my hands, one above on the femur, one below the joint on the tibia. I bring them into about 30 degrees. You should be playing good. Let your leg relax. There you go. Okay, he's going to be relaxed there, and again I'm going to pull towards me with the tibia, and I'm going to apply counter pressure with my thumb on the femur. And so I'm trying to translate the tibia forward on the femur to see if there's excess movement. Okay, I like that one, especially if I have an athlete that's not an offensive lineman. If I have a big offensive lineman, do you really think I'm going to be able to do this? No. So there's different ways that you can like maneuver. You can put the leg underneath and you can try it that way. A drawer test seems to be the best when I have larger athletes and just have them stabilize and pull. Okay? So those are the 4 different ligaments all tested. There are some other methods, but those are 4 of the main ones that we'll talk about. On another lab day, I'll show you some meniscus tests and some other stuff, but we're pretty much out of time. Okay?
Yes, ma'am.
Got it? All right.